Welcome back. I'm Nick Smith. Just weeks after the World Health Organization listed aspartame as a substance that could possibly cause cancer, another item has sparked interest in whether it's safe: aloe vera. It's found in many of our everyday products. Today, it includes lotions, deodorants, shampoos, and conditioners, amongst other things. Now, the WHO placed aloe vera on their carcinogenic hazards list back in 2016. It's ranked with other carcinogens like hazards like engine exhaust, gasoline, even pickled vegetables. Joining us now for more insight on this is medical expert Dr. Frita Fisher. Dr. Fisher, good afternoon.
Good afternoon, Nick.
Dr. Fisher, do I need to be worried about that aloe vera lotion, or is this something else where you're going to tell us, in moderation, Nick, you're fine, just pay attention to the label?
Nick, you've got it. I'm going to tell you in moderation. So aloe vera has many uses. It's a ubiquitous plant, and it has gels. It has a clear aloe vera gel, which you can find in sunscreens, lotions. It can help with acne, with psoriasis, with sunburns for sure. But then there is an extract, this yellow sap called aloe vera latex, that can actually, in mice, if taken orally, okay, if you swallow it, it can potentially cause cancer. There was a study, Nick, in 2013 that studied mice, and it showed that mice who took in a lot of the oral yellow sap in aloe vera had an increased risk for a rare intestinal tumor, but rats who took in a smaller amount did not develop the tumor. So again, this is an animal study. Now, some people do use aloe vera orally. They do drink it or they eat it, and it can be used as a laxative, and it has some side effects where it can cause abdominal cramping. If you're someone who takes aloe vera orally, then you really do need to be careful. But studies show that it would take 1 gram every day in order for it to have really likely cancer effects or carcinogenic effects. So yes, it's something we should be aware of, but I don't want everyone to panic and start throwing away sunscreen.
Dr. Fisher, is this how these things usually work? When you find something that people are using, you say, you know what, let's test it in every possible way so that we can try to determine what one of the factors could be that cause problems so that people are aware. But if you're using it the way it's prescribed, Nick, you should be fine.
That's really the case. And, you know, we have so much data at our fingertips that in so many studies, that it really is a difficult balance in letting the public know possibilities of harm versus causing a great unnecessary panic. In the case of the World Health Organization, they organize possible and probable carcinogens in groups. You have a group of things that are definitely carcinogenic, things that we know from studies will cause cancer, like asbestos, smoking. And then you have the probable carcinogens, which may surprise you because red meat and working overnight are on the list as being probable cancer-causing agents. But then when you get to possibly carcinogenic, that's where you have some studies in mice, but you have a little bit of potential evidence in humans. And even cell phones, radioactive frequency from cell phones are in this possible carcinogen list. So the cell phones, aspartame, that artificial sweetener, and aloe vera, all on that list. I don't want anyone to panic, but just, moderation and be careful.
Put down my lotion, my iPhone, and put down the diet soda, or else I'm in trouble. Dr. Fisher, is there something you would recommend as a substitute for those who may have concerns? You're like, I'll wean myself off of the aloe vera. What would you suggest?
I would suggest that if you are actually someone who is, squeezing aloe vera gel out and you're putting it in your smoothies or you're eating it or drinking it, I would say stop at this point and consult with your physician. If you're using it for a laxative, there are other laxatives that are much, much safer than this. But if you're using it topically and it's the clear gel, then I think you're fine. But as always, consult with your physician, but no panic. Everyone keep calm and carry on.
Dr. Frita Fisher, I'm going to tell you this. If aloe vera is going to give me that skin, I'm going to go get me some aloe vera. Dr. Fisher, thank you so much for joining me this afternoon.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.